Imagine your body as a busy city and sugar as the fuel trucks driving through its streets every single day. When the traffic flows smoothly, the city hums with energy, your mind stays sharp, and your body feels light. But when too many trucks pile up at once, or when they stop showing up on time, the whole city starts to break down. Fatigue creeps in, cravings take over, sleep becomes restless, and over the years, this quiet imbalance can turn into a serious health problem. This is exactly what happens inside millions of bodies around the world every single day. And the good news is that most of it can be prevented, slowed down, or even reversed without a single pill. Blood sugar, or glucose, is not the enemy. It is actually the primary source of energy for every cell in your body, including your brain. The problem is not sugar itself, but how much of it enters your bloodstream, how fast it enters, and how well your body is able to handle it. When you eat food, especially carbohydrates, your digestive system breaks it down into glucose, which enters your blood. Your pancreas then releases a hormone called insulin, which acts like a key, unlocking your cells so glucose can enter and be used for energy. When this system works well, your blood sugar stays steady and balanced. But when you eat too much sugar too often, move too little, sleep too poorly, or carry too much stress, this system starts to struggle. Insulin becomes less effective, glucose stays in the blood longer than it should, and over time, this leads to fatigue, weight gain, and eventually conditions like prediabetes or type 2 diabetes. The most powerful tool you have to manage blood sugar naturally is food, and specifically, the order and combination in which you eat it. One of the simplest tricks, backed by real science, is to eat your vegetables and protein before you eat your carbohydrates. This single change in eating order can significantly reduce the spike in blood sugar after a meal. So instead of starting your plate with rice or bread, start with the salad, the vegetables, or the protein, and finish with the starchy part of your meal. This slows down how quickly sugar enters your bloodstream, giving your body time to respond calmly instead of being overwhelmed all at once. Fiber deserves special attention here because it acts almost like a traffic officer, slowing down the absorption of sugar into your blood. Foods rich in fiber, such as leafy greens, beans, lentils, oats, whole fruits, and vegetables, take longer to digest, which means glucose is released slowly and steadily instead of flooding your bloodstream all at once. This is very different from sugary drinks, white bread, and refined snacks, which digest quickly and cause sharp spikes followed by sudden crashes. Those crashes are often what trigger cravings for more sugar, creating a cycle that is hard to break. Choosing whole, minimally processed foods over refined ones is one of the most effective long-term strategies for keeping blood sugar stable. Another important idea is the concept of the glycemic index, which simply measures how quickly a food raises blood sugar. Foods like white rice, white bread, and sugary cereals rank high, meaning they spike sugar fast. Foods like whole grains, legumes, most vegetables, and many fruits rank lower, meaning they release energy more gradually. You do not need to memorize a chart or become an expert in nutrition science to benefit from this. The simple rule of thumb is to choose foods closer to their natural state and to pair carbohydrates with protein, fiber, or healthy fats, which naturally slows down digestion and softens any sugar spike. Hydration is another quiet hero in this story. When your body is dehydrated, your blood becomes more concentrated, which can make blood sugar levels appear higher and puts extra strain on your kidneys as they try to filter out excess glucose. Drinking enough water throughout the day helps your kidneys flush out excess sugar through urine and supports every single metabolic process in your body. Replacing sugary sodas, juices, and sweetened beverages with water, herbal tea, or infused water is one of the easiest changes anyone can make at any age, without needing any special equipment or knowledge. Now let's talk about movement, because physical activity is one of the most underestimated tools for blood sugar control. When your muscles are active, they pull glucose out of your bloodstream to use as fuel, and they can do this even without much help from insulin. This means that a simple walk after a meal can meaningfully lower the blood sugar spike that follows eating. You do not need an intense gym session to see benefits. Even 10 to 15 minutes of walking after lunch or dinner can make a real difference. Over time, regular movement, including walking, cycling, swimming, dancing, or any activity you enjoy, improves how sensitive your cells are to insulin, meaning your body needs less of it to do the same job. Strength training, such as lifting weights or doing bodyweight exercises like squats and push-ups, is especially powerful because muscle tissue acts like a sponge for glucose, soaking up sugar from the blood and storing it for later use. The more muscle you build, the more storage capacity your body has, and the easier it becomes to keep blood sugar levels steady. Sleep is another piece of this puzzle that is often overlooked, yet it has an enormous impact. When you do not get enough quality sleep, your body produces more stress hormones like cortisol, and your cells become less responsive to insulin, almost as if they become tired and sluggish, just like you feel after a poor night's rest. Studies have consistently shown that even a few nights of poor sleep can noticeably worsen blood sugar control in otherwise healthy people. Aiming for 7 to 9 hours of consistent, quality sleep each night is not a luxury. It is a fundamental part of managing your metabolism naturally. Creating a calming bedtime routine, limiting screens before bed, and keeping a consistent sleep schedule can go a long way in supporting this. Speaking of stress, it plays a much bigger role in blood sugar than most people realize. When you are stressed, whether from work, relationships, financial pressure, or simply the pace of modern life, your body releases hormones like cortisol and adrenaline. These hormones are designed to give you a quick burst of energy for a fight or flight response, and one way they do this is by signaling your liver to release stored sugar into your bloodstream. This was incredibly useful for our ancestors who needed sudden energy to escape danger, but in modern life, where stress is often constant and rarely resolved by running or fighting, this extra sugar simply stays in the blood, contributing to long-term imbalance. Finding ways to manage stress, whether through deep breathing, meditation, prayer, spending time in nature, journaling, or simply talking to someone you trust, is not just good for your mental health. It is a direct tool for physical blood sugar management. Meal timing and consistency also matter more than people often think. Skipping meals and then eating a large meal later can cause a bigger blood sugar spike than eating smaller, balanced meals at regular intervals throughout the day. This does not mean you need to eat constantly or follow a rigid schedule, but having some consistency in when you eat helps your body anticipate and regulate its insulin response more efficiently. Similarly, eating very late at night, close to bedtime, can interfere with how well your body processes that sugar, since your metabolism naturally slows down as you prepare for sleep. Giving yourself a few hours between your last meal and bedtime can support better overnight blood sugar control. Certain natural foods and habits have also shown promising effects when it comes to blood sugar. Cinnamon, for example, has been studied for its potential to improve insulin sensitivity, and adding it to oatmeal, coffee, or smoothies is a simple, harmless way to include it in your diet. Apple cider vinegar, taken diluted in water before meals, has also shown some ability to blunt post-meal blood sugar spikes in various studies. Foods rich in magnesium, such as nuts, seeds, and leafy greens, and foods rich in chromium, such as broccoli and whole grains, play supportive roles in how your body processes glucose. These are not magic solutions, but small additions that, combined with everything else, contribute to a bigger picture of balance. Weight management is closely tied to all of this, particularly excess fat stored around the abdomen, which is metabolically active and can interfere with how well insulin works. You do not need to chase an extreme body type or a number on a scale. The goal is simply supporting a healthy body composition through the same tools already mentioned: better food choices, regular movement, good sleep, and lower stress. As your body composition improves naturally over time, insulin sensitivity often improves right along with it. Alcohol and smoking also deserve honest mention. Excessive alcohol can cause unpredictable swings in blood sugar, sometimes spiking it, and sometimes causing dangerous drops, especially when combined with an empty stomach. Smoking, on the other hand, has been consistently linked to increased insulin resistance, meaning the body has to work harder to keep blood sugar under control. Reducing or eliminating these habits is one of the most impactful things a person can do for their long-term metabolic health. Perhaps the most important thing to understand through all of this is that managing blood sugar is not about a single dramatic change or a perfect diet. It is about small, consistent choices repeated day after day. Choosing water over soda most of the time. Taking a short walk after most meals. Getting a bit more sleep most nights. eating vegetables before carbohydrates most of the time. None of these choices need to be perfect every single day to create real, lasting change. The body is remarkably responsive to consistent, gentle care, and over weeks and months, these small habits compound into a genuinely healthier metabolism. It is also worth saying clearly that natural strategies are powerful, but they are not a replacement for medical guidance, especially for anyone who has already been diagnosed with diabetes or another condition affecting blood sugar. Regular checkups, blood tests, and conversations with a healthcare provider remain essential, and these lifestyle strategies work best as a partner to medical care, not a substitute for it. But for the millions of people looking for ways to support their body naturally, to feel more energetic, to sleep better, to think more clearly, and to protect their long-term health, these habits offer a real, accessible, and deeply human path forward. It does not require expensive supplements or complicated routines. It simply requires attention, consistency, and a willingness to treat your body with the same care you would give to something you truly value, because that is exactly what it is.